So having looked at infections as well as metabolic diseases of the bone, now we're going to focus on neoplasms. For neoplasms, the epidemiology is extremely important. In children in the young age group, we are very worried about malignant bone tumors, particularly Ewing sarcoma. That's a small round blue cell tumor, very aggressive. And in also young patients, teenagers to young adults, perhaps early 20s, in terms of benign tumors, they tend to get this tumor called the chondroblastoma, which is a cartilaginous tumor that occurs in the epiphysis. Now, osteosarcoma is the most important, arguably, malignant tumor in the bone. It is the commonest malignant tumor, and it occurs in the young age group. There is also osteosarcoma that can occur in older patients, and this is possibly due to secondary causes like Paget's disease or perhaps radiation-induced osteosarcoma. And in older patients, we would be worried about chondrosarcoma, which is a cartilage-producing malignant tumor. And as I mentioned, secondary osteosarcoma, for example, secondary to radiation. Now, the location of the tumor is also very important, meaning which bone is the tumor actually located in. For example, osteosarcoma tends to like to occur around the knee joint, and chondrosarcomas tend to favor the flat bones. Which part of the bone specifically is also of utmost importance? If you take a look at this picture here, within the diaphysis or the diaphyseal region, which is essentially the shaft of the bone, a very important tumor to take note of is the Ewing sarcoma. And remember, this occurs in children. Now, in the metaphyseal region, the most notable and most important tumor is the osteosarcoma. So this occurs in the metaphysis, usually around the knee. Osteochondroma is another tumor that can occur in the metaphyseal region, and this is a benign tumor that is composed both of bone as well as a cartilaginous cap. Now, in the epiphysis, there are two tumors to take note of. One is benign, and this is the chondroblastoma, and this occurs in younger adults. And the other is potentially malignant, and this is giant cell tumor, and this can occur often right up into the almost abutting the joint surface. So now we're going to look at specific benign and malignant bone tumors. So again, we always just simply classify them into benign versus malignant. Of course, for malignant tumors, we must always consider the possibility that this may represent a metastatic tumor. One of the clinical clues to METs is the fact that the tumors are multiple, or they are at multiple sites, multiple locations within different bones, perhaps different vertebrae or different parts of the skeletal system. And also, of course, the patient is usually rather ill and may have a history of a known malignancy. And of course, here we're going to be discussing the primary malignant tumors. So we can divide them into tumors that are bone-forming. Among the benign tumors, we have the osteomas or the osteoid osteomas, and the malignant tumors, we have osteosarcoma, which is the commonest bone tumor. And again, if you just recall, very recently, we just mentioned that this tends to occur in the metaphyseal region. Now, we also have cartilage-forming tumors, and again, we'll start off with benign, which includes the chondroblastoma, which is one of the two tumors that likes to occur in the epiphyseal region, if you remember, from this little diagram here. And the malignant counterpart is the chondrosarcoma. Now, chondrosarcoma is the second commonest malignant bone tumor. So we have to be very careful because osteosarcomas can sometimes produce chondroid. So we sometimes have to go by age, epidemiology, location, radiologic picture as well. Now, there is a tumor that is composed both of bone and cartilage, and this is the osteochondroma. So I mentioned it earlier over here. It is often an exophytic growth, like having a mushroom-like protrusion with a stalk, and the cap is a cartilage cap, or it's covered by cartilage. And sometimes there can be multiple osteochondromas in specific syndromes, which I'll leave you to read up on. And sometimes in these instances, there is a higher risk of malignant transformation, and usually the malignancy would be a chondrosarcoma. Now we've got others as well that don't neatly fall into these groups. The very important malignant tumor here is Ewing sarcoma, and this is the third commonest malignant tumor in the bone. This occurs in young children and in the diaphyseal region, as you can see in that diagram. And it is known as a small round blue cell tumor. Why do we call it a small round blue cell tumor? Essentially, this is because on histology, the tumor really does look like packed sheets of small round blue cells, and often there are very high mitotic counts or sometimes apoptotic figures as well. So it's a very aggressive tumor. And Ewing sarcoma is typically associated with translocation T1122, and I will leave you to read up on the specific name or the specific genes that are translocated. Now, others in the same category would include giant cell tumors. Giant cell tumors, I'm sort of putting in the middle between benign and malignant. Most of them behave in a benign fashion, but occasionally they can metastasize and have more malignant or aggressive behavior. This is the other epiphyseal tumor, if you remember, and usually occurs in skeletally mature adults. Now, the other entity here is Langerhans cell histiocytosis. The Langerhans cell is a specialized type of macrophage, and these tumors typically show sheets of these macrophages. They are generally, most of the time, mononuclear, and very interestingly, they have a little groove in the nucleus, almost like the nucleus of papillary thyroid carcinoma. This is not to be confused with Langerhans cells or Langerhans giant cells. Langerhans cells are what we see in granulomatous inflammation, in particular in tuberculosis, and these are the cells with a horseshoe arrangement of nuclei, whereas the Langerhans cell have this mononuclear appearance. Most of the time they're mononuclear with a nuclear groove and lots of eosinophils in the background. So Langerhans cell histiocytosis can occur at a single site, in which case the prognosis is better, or they can occur at multiple locations and or polyostotic. And examples would be Hans-Schüller-Christian disease or Litterer-Sewer disease, and these usually have a worse prognosis compared to a single site involvement. Now, in terms of clinical presentation, neoplasms of the bone, they can sometimes mimic infections such as TB or sometimes even bacterial infections because they can present clinically with pain, with swelling, with loss of function, and sometimes even with a fever. Sometimes these tumors first present as a pathological fracture because the bone in that area is weakened and replaced by soft tissue. Osteosarcomas are examples of tumors that can occur like this, and so we have to be very careful when young people end up fracturing their bones with minimal trauma. They can also result in systemic symptoms like anemia and loss of weight, and to make things worse, even harder to distinguish between this and infection sometimes. The blood test may actually reveal raised total white counts and raised ESR. So here is just a summary of the main tumors that affect the bones. Again, remember, epidemiology is important, location is important, which bone and which part of the bone, and I've just run through some of the commoner benign and malignant tumors in the bone.